Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Like any long-term health problem, chronic pain can limit your quality of life and lead to additional serious health problems. Treating chronic pain can be tricky. What works for one person may not work for another, and the long-term use of pain medication presents its own set of problems.
Mayo Clinic's Pain Rehabilitation Center helps people with chronic pain to return to a more active lifestyle. Pain rehab incorporates behavioral, physical, and occupational therapy to help restore physical activities and improve quality of life for those suffering from chronic pain. Here to discuss is Mayo Clinic psychologist Dr. Jeannie Sperry. Welcome to the program, Dr. Sperry.
Thank you.
Dr. Sperry, nice to have you with us.
Thank you.
So we all know this is a common problem, but how common is it really?
So studies show that about a third of the United States population suffers from chronic or recurring pain. So it's a large amount of the population. It's more prevalent in certain populations, for example, returning veterans.
Wait a minute, that's like 100 million people, or are we just talking about the adult population?
We're talking about 100 million people report having pain on a recurrent or chronic basis.
And how do you, what's the difference? How do you define it, chronic pain versus acute? What does chronic mean?
So chronic pain typically is looked at for more than 3 to 6 months after the typical healing period from an injury or surgery, for example, would occur. And it's typically looked at, it has an increasingly negative impact on people's lives over time. So it starts to affect their work, their relationships, their social functioning, and increasing amounts of disability and really distress over time.
Is there a common chronic pain patient? I mean, I see this and I actually just think back pain, but is there a common patient?
Every patient is different, and we all experience pain differently. So it's very common. Back and neck pain is very common. Musculoskeletal pain is common. But we see patients with post-treatment pain for like chemotherapy or radiation pain. We see patients after sports injuries, work injuries. So pain is experienced very differently. Headache is very common also. A lot of what we see in the center where I work is what we call generalized pain or chronic widespread pain. So again, pain that is spread beyond the original injury or condition to really having a wide impact on both the body and people's lives.
Well, that's got to be difficult. I've got pain everywhere. Where do you start?
So you start with a comprehensive approach. What we know is that, again, pain is very complex. It's multi-determined, and so a multi-dimensional, multimodal approach is used with these kinds of patients. So we address kind of all the factors related to pain. So we work on physical conditioning. We work on how people perform daily activities with occupational therapy. We do medication management, make changes in medications, and we also look at how people think and behave in pain and work on changing those aspects of their life as well.
Yeah, how do you do that, the behavioral part?
So what we see is that, again, pain starts taking over people's lives over time. They start thinking about pain and ruminating about pain and worrying about the future. They behave in ways that inadvertently make things worse by avoiding activity or avoiding relationships that could be helpful. So we really promote a very active rehabilitation approach. So we actually have classes where we help people address how they think about their pain and various chronic symptoms and change those to be actually more helpful and to motivate them to make other behavioral changes. We gradually increase activity. Often people become fearful of doing different activities because they're afraid their pain will get worse. And so we have a very gradual, systematic approach to increasing activity so they become less painful, less fearful of pain, and be better able to re-engage in activities that they value in life.
When we got started, you mentioned offhandedly that veterans experience chronic pain, and I'm curious about that. What do you know about, tell us what you know about that.
Well, with modern technology, our veterans are surviving accidents and injuries that in previous years they wouldn't have survived. But there are certainly some after effects of that. So we know that people are surviving after lost limbs or serious head injuries. And there are also, again, the psychological components of being in combat and seeing very difficult things. And all those interplay, they interact to create conditions in people that really promote pain and disability and fearfulness of activity. And so there's a high prevalence, and these are, again, complicated individuals often coming back and don't have the same social structure. Their jobs aren't there anymore, et cetera. So there are a lot of aspects to address in their lives, and one type of treatment approach is typically insufficient.
Is this an inpatient program, and what is the average length of stay?
So most programs like ours are 3 to 4 weeks, and they are hospital-based. So we're based in a hospital, but it's an outpatient program. So people typically come and in our programs, come and stay for 3 weeks in Rochester, and they stay in hotels locally while they're in treatment.
And how do you screen the patients? How do you know which patients, are they all referred to you, and how do you know which ones are candidates?
So we have an evaluation process, and we look at their medical records to determine if medical workups are complete. So we know that they need to be able to participate in some aerobic activity every day, although we have patients who come to us even in wheelchairs, and some are very deconditioned, some are missing limbs, but be able to participate in physical activity every day. Pain for more than 3 months that is having a significant impact on their life and their quality of life and their functioning. And that are willing to address medications. We taper opioids and some other medications that sometimes have been used chronically that are actually recommended for acute. So we managed to be willing to taper off those medications, willing to participate in a 3-week program that really is based on improving their quality of life, not necessarily making all their pain go away.
How has the work that you're doing changed with opioid, the crisis, or the situation of having more opioids present for patients to use?
So I've been doing this kind of work in rehabilitation for quite some time, and previously we didn't see this many people who were taking opioids. It's always been part of programs like this to do medication management. Certainly in the past 10 years, the number of patients coming on a lot of medications, sometimes for many years, even decades, and at high doses, has certainly increased, which increases the medical complexity. Sometimes they have other complicating medical conditions, and so working on their medications can be kind of tricky. That's why we're hospital-based and have such a significant number of team members.
And the use of opioids, can't that increase the amount of pain that a patient is feeling?
Yes. So what we find is that opioids really were designed for treating acute pain, and that over time there are changes in the brain that occur that actually make people more sensitive to pain with the use of pain medications. So kind of paradoxically, what we find is that people are fearful of coming off medications, but when they are off those medications, they actually start feeling better, often pretty quickly.
Do you have a typical patient, a male, female, young, old? Is there a typical patient?
I don't know that there is. We have a pediatric pain program here at Mayo, as well as an adult program. So we see patients from the age of 13 to well into their 80s, and pain is more prevalent in women. But we have both males and females, and they really, people are different. Their experience is different. It's interesting, though, that when they're in a group of people who are all dealing with pain, they really reinforce improvements in each other. That pain can be so isolating, and when people are together working on a common goal of getting their lives back, it's very empowering for people.
Final question. How successful is the program, and how do you know if you've been successful in helping someone?
So we evaluate our patients very carefully before they come in. We perform both physical and self-report measures when they enter the program, when they leave 3 weeks later, and then again 6 months after that. And we find 80% of our patients report very significant benefits. Most patients, even 6 months after the program, are still not taking pain medications. Their physical functioning has improved, and they report much better mood, much better quality of life. They perceive their health is better. They have less pain and much less impact of pain on their lives.
All right, well, that's pretty impressive. We've been talking about pain rehabilitation clinics with Mayo Clinic psychologist, Dr. Jeannie Sperry. Thanks so much for being with us.
Thank you.